Secretary Dr. Haji Jufri bin Ahmad, Minister of Health of Malaysia, Professor Anupam Sibal, Group Medical Director and the Senior Pediatrician, Apollo Medical Group, Apollo Hospital Group, and the moderator of this panel discussion. Distinguished guests, colleagues, good morning. It is my honor to join this panel discussion titled The Healthcare Objectives and How Hospitals Can Help, and present WHO's view on this. As introduced by Dr. Sibal, my name is Dr. Kidong Park, the WHO representative in Vietnam. I'm a public health physician trained with health policy and hospital management specialty with more than 30 years of experience. Of this, including 12 years of experience in the health ministry in my home country, Republic of Korea, and then additional 13 years of experience at World Health Organization. The World Health Organization, WHO, which I'm representing today, was established in 7th April 1948 as the directing and coordinating agency in global public health within the United Nations system. Its mandate, its objective is the attainment of the highest possible level of health by all people. It has almost universal membership with 194 member states and then very extensive country presence with 149 country offices. All the WHO member states and then all the UN member states signed off the 2030 Agenda for Sustainable Development with 17 goals and then 169 targets to achieve by 2030. WHO will focus on its work in order to be on track for delivery of the health-related SDG targets on 3 strategic priorities. And that you will see on the screen to reach 3 billion goals in next 5 years, which means 1 billion more people will be benefiting from universal health coverage. 1 billion more people will be better protected from health emergency. 1 billion more people will be enjoy better health and well-being. My intervention today will focus on WHO policy on universal health coverage, UHC, and the role of hospitals in achieving UHC. Strengthening primary health care, PHC, is the most inclusive, effective, and efficient approach to advance UHC and enhance people's well-being, physical health, and then mental health. It was clearly written in the WHO Constitution and confirmed by the Declaration of Alma-Ata in 1978. Last year, in October 2018, leaders of the WHO member states gathered in Astana, Kazakhstan, and renewed their commitment to PHC, which means primary care and essential public health functions are the core of the integrated health services. Here, I want to quote a statement by Dr. Halfdan Mahler, former WHO Director General, who led the PHC initiative and the Alma-Ata Conference on PHC in 1978. He said, a health system based on primary care without a health system based on primary care cannot be realized without support from a network of hospitals, which was true, and then which is more relevant now than ever. Hospitals are core to service delivery. They provide acute and complex services and then contribute to the patient's overall health outcomes. They support other healthcare providers through community outreach. They are also an integral part of the health emergency preparedness and response. They provide settings for education and training for health professionals. They lead clinical research. Achievement of UHC requires clear determination of the role of hospitals in service delivery and targeted efforts to optimize their performance. When hospitals perform well, the overall performance of the health system improves. However, many countries in the world, many countries in Asia are struggling to improve hospital performance as well as overall health system performance. I don't need to mention what issue they are having. I just want to jump in what WHO is doing. In order to assist the member states to improve hospital performance, WHO in the Western Pacific has developed a regional framework on improving hospital planning and management in the Western Pacific, which was approved at the Regional Committee last year, 2018. This framework provides action areas and action domains to improve hospital management and planning, both at facility level and system level. At the facility level, hospitals can improve their performance by increasing accountability, sustainability and resilience, quality, efficiency of the day-to-day operations, and ensuring equity. You may wish to remember these 5 as ASQEE. ASQEE. Hospitals can increase accountability by introducing clear management structure, compliance to government regulation, and performance monitoring. Sustainable and resilient hospital system is based on the sound governance structure, which is able to adapt to change in the external environment and mitigate risk. Quality of service at hospital will include clinical governance structure and processes, patient safety, technical quality, patient and family experience, patient-family happiness, continuity of care. Efficiency gain at facility level at hospital could be achieved through effective operational management, including streamlined patient flow, streamlined supply and logistics management, and appropriate health staff numbers and competencies. Hospitals can contribute to UHC by ensuring that there is equity in access to health services. At the system level, health authorities, health ministries, Department of Health can use the framework of the GILFF, G-I-L-F-F, goal, institutional arrangements, regulation, financing, and feedback as the governance tool to improve hospital performance. Goal, health authorities should set clear goal on the role of the hospitals in a path to UHC in each country. Hospitals must play an important role. For countries to achieve UHC, they may either function as a standalone facilities or be affiliated in a network of the group of the hospitals. Institutional arrangements have 3 action domains of the system-level governance, service planning, and service delivery architecture. Hospitals can improve their overall performance if they have some autonomy and authority to plan services, authority to manage staff and other resources, and authority to respond flexibly to patient need. However, government must retain responsibility to ensure the accountability of the hospital operations. This balance can be achieved through various modes of the hospital governance, for example, a hospital run as a corporation or a state-owned enterprise or government-owned hospital, and supervised by the governing body or supervised by a committee. Regulation. The regulation of the facility, the regulation of the staff is important to ensure equitable access to quality health services. Financing. Financial incentives drive provider behavior. All countries must decide what service should be publicly funded, either from state budget or health insurance fund, regardless of the maturity of their health financing system. With budget constraints and then emerging new health interventions, countries must make critical decisions on benefit design and resource allocation. Strategic payment method can improve efficiency, accountability, and equity and quality, and reduce financial hardship. Finally, feedback. Feedback of the relevant information can reinforce hospital accountability by creating communication loops, improving both staff and community participation. Key feedback mechanisms may include quality and patient safety monitoring, access and equity monitoring, efficiency and productive monitoring, and risk monitoring. This is my last slide. As socio-political, economic, and cultural contexts surrounding health sector and the surrounding hospitals are different country by country. Pathway towards UHC will be also different country by country. However, a health system based on primary care with support from network of hospitals is the key to achieve UHC. Every country is moving towards UHC. Every country is moving towards being a healthier world. WHO, which I'm working in, is committed to support its member states and travel together towards UHC. Thank you.